Greg Hunt has told the House is that this vaccine, this doctor was not trained. That essentially the advice from Healthcare Australia, the contractor was the doctor was trained to administer the vaccine, and that advice has been revised to say the doctor had not done the online training. Now, this is a real blow, and Greg Hunt says he's now going to get the department to take action not only against the doctor, but the contractor as well.
The Queensland Premier, Anastasia Palaszczuk, called for an emergency national cabinet. She was shocked by this. Basically, we're talking about an overdose of the vaccine. They're saying in the clinical trials it hasn't had adverse effects. That being said, an overdose is still a serious matter, and particularly when the doctor wasn't trained suitably for this task.
This is a shocking blow because we saw Scott Morrison get all that positive publicity at the start of the week in terms of his vaccination, and now we have this situation where we find out one of the doctors administering it in an aged care home was not trained. Now, Greg Hunt's actually apologised to the House of Representatives in connection with this. Let's hear the statement he gave to the House a short time ago.
The advice I've just received from Deputy Chief Medical Officer Michael Kidd provides a correction to that which was previously provided to me. Earlier today, the Vaccine Operations Centre provided the following public statement in writing. Healthcare Australia has confirmed the doctor had undertaken the training, and then just before question time, the report from the Deputy Chief Medical Officer confirmed in writing Healthcare Australia has advised that this doctor and all health professionals involved in the immunisation rollout have completed the online training provided through the Australian College of Nursing, and the company has advised that it has copies of the successful certificate of completion of the course for each health professional. The revised advice is that on further investigation, Healthcare Australia has now advised that the doctor had not completed the required training. This is being investigated by Healthcare Australia, and we are expecting a report later today. Healthcare Australia has advised that all other Healthcare Australia immunisers have completed the training. Healthcare Australia has also advised that this doctor has not been involved in the vaccine rollout in any other facilities. Given this, 1, I apologise to the House for the inadvertence. 2, I have again reaffirmed my apologies to the family. And 3, I have asked the department to take action against the company and the doctor for what is a clear breach on both fronts. I table both pieces of written advice to which I refer, which confirm the advice of Healthcare Australia as previously stated.
So just to reprise, I mean, what a blow for the government. It's so critical that they get their target of a 90% take-up rate of this vaccine. And there are a few people who are in doubt. We know that polls show there's about 25% of people who are concerned about the safety of this thing. Now, I just want to reassure viewers that the advice I have is, even if you get 4 times the amount like these people did, it has had no effects in clinical trials. So this is not something you OD on, really, with that sort of mistake. But what is concerning for the federal government in particular is that the people now won't want to be vaccinated, or just generally that their handling of it looks like a complete schmozzle, to be honest, Kieran. I mean, this is often a problem when federal governments are involved in service delivery rather than state governments, and this has always been the concern that there will be many hiccups in this vaccine rollout.